cannot afford in nursing education to lose one person. The time, the energy, and the cost to replace people is just like you said, it's just incredible. So why wouldn't I, as a leader, spend that extra time and effort?
Mentoring, retention, and authentic leadership. In this energizing episode, we'll connect the dots on how to nurture excellence in nursing education. Welcome to Lippincott Spark, Illuminating Nursing Education, the podcast that fuels teaching, innovation, and leadership. I'm Dr. Kelly Dries. Each episode, we spotlight bold ideas, expert voices, and practical strategies to help you teach smarter, lead stronger, and stay inspired. Let's spark new thinking and dive into today's episode. Hello. In this inspiring episode of Lippincott Spark, we're joined by Dr. Kimberly Dunker, a powerhouse in nursing education and leadership. A full professor with over 25 years of experience, Dr. Dunker currently leads as the director of the MSN and DNP program at Loma Linda University. With a deep commitment to strength-based leadership and a passion for empowering others, Dr. Dunker shares actionable insights on fostering resilience, building high-performing teams, and leading with authenticity. So whether you're a seasoned nurse educator or leader, or just beginning in your journey, this conversation will spark fresh ideas and energize your path forward. Welcome, Kimberly.
Thank you so much for having me today, Dr. Dries. I am so excited to talk about something that's very passionate to me, and I'm pleased to be here.
We're going to jump right in. How do you define excellence in nursing leadership, and how does team building contribute to it?
Well, when we decide to become a leader, we have to think about things not just of ourselves anymore. We have to think about others. And so excellence in leadership cannot happen without our team. And you learn that pretty quickly in nursing because nursing is all about teamwork. And when you're working as a bedside nurse, you know that you rely on your team, but you really don't have a lot of control of how people interact with each other and how that team works. So most of us, when we become nursing leaders, we don't have a whole lot of formal training when it comes to managing and building our teams. So a lot of it is trial by fire, like when we interact with our patients, you start to begin and learn. And one of the things I would say, as I've learned in my journey, is that excellence really begins with knowing yourself. And it wasn't something that I learned right away in my first nursing leadership position. It was something that I learned just recently, that I really have to know who I am in order to lead my team. And when we say we're authentic, I lead with authenticity. That means my team knows who I am every day, and I'm not a different person depending on the situation. And that is really, I think, one of the key things when you're trying to build the team. The team can't be guessing every day of who you are as a leader. The first thing you need to do is what I call lead yourself. And that's really when you take some time and really spend time knowing who you are, what your traits are, what are your values, knowing your philosophy, and not just leadership, but how you manage others and work with others, knowing the ethics of what you do. So I would suggest taking some time, and you can take a free test or you can use strengths. I think the strengths-based leadership is one of the best things I've ever done for myself and my team. And we're going to talk a little bit more about that. You can purchase that. It's a little bit of a fee to purchase your 5 top strengths through Clifton Strengths, or you can do free versions. They have, the high 5 test, but getting your team to take responsibility of who they are as a leader, I think is a really good, important first step to how we build our team.
Important to know yourself and the skill set and the strengths that your team has. In my experience too, I always thought, I got to be the smartest person in the room. I got to know all the answers. And really, it's not about that. It's about surrounding yourself with really strong faculty, really strong leaders that can, move that mission forward. So I know building excellence through kind of these team dynamics, we know that sets kind of a strong foundation. So I'd like to shift to a common challenge many organizations face, which is mentoring. And I've had the pleasure of hearing you talk a little bit about mentoring, knowing that obviously helps faculty navigate the curriculum and classroom management and even kind of that unwritten academic culture. It reduces stress and anxiety. But what are some of the biggest barriers when you see a team trying to implement a structured mentoring program for faculty?
Oh, you see this. This has been so much in the literature. Mentoring is so, so important to developing people. And the question is, especially as for us leaders, is number one, how do you identify who the mentor should be? Because not everybody, based on your strengths, right, should be and can be a mentor. And then what kind of training do we have? Because you can identify the best person, but you also need to set expectations of what that looks like. And then my biggest thing as a leader is then how do you compensate for that time? Because while we would like to say mentoring, you should do it because it's part of your profession and it's part of your rank and tenure. We know that you kind of get what you pay for. And so if you don't have an allocated workload around mentoring, especially for me as a leader, what I've seen is it's a huge barrier to getting the buy-in of people, because you also can't burn out people that are wonderful mentors and they do it because they lead from the heart and they just do it because they believe, I'm a service profession, because I've seen that, you use those mentors over and then they're exhausted because they're so burnt out. So there's multiple layers to that, right? We know we need to do it. We want to say we do it. We say that with our new grads all the time. You will be precepted and it will look like this. And in some organizations for new grads, they have mentoring too. And we want to mirror that in nursing education. It really should start there. But our profession is, we have such an incredible need and faculty shortage that we're dealing with as well. So you have the best seasoned people, but they're decreasing in number on the faculty, and we're replacing it with people that need a ton of mentoring. Because as we see, the faculty coming to teach for us, they're coming from all different skill sets, not just strengths, and different preparation levels. So while mentoring is important, we have to, as leaders, find a way to make it organized and structured and have I believe, some kind of pay compensation. And this is a conversation that happens, I believe, across all nursing programs with lots of leaders. Like, we need this, but how do we pay for it? Because I don't have a budget line for mentoring or orientation.
We know that mentoring programs are more than just the support system. We see that it drives career satisfaction. We're seeing that it drives retention. I was reading the 2024 study that revealed that structured mentoring programs, especially with trained mentors, can reduce faculty turnover by up to, 15%, 20%. There's some really compelling models out there. There's one called, Growing Together, kind of that framework where if you've got the mentor and mentee really emphasizing that importance of mutual trust and emotional connection and, that shared growth, because at the end of the day, we want to build and foster that culture of belonging and kind of that professional fulfillment. So I'd love to explore how these kind of strategies intersect and how institutions can harness them to build resilient, thriving academic teams. So how does faculty retention tie to mentoring and team building strategies?
Well, as a leader, you look at your team and you say, okay, I've got this team here. You want to spend all your time developing them, and then you want them to stay. Faculty retention has been something that I've been passionate about. So I look at all different avenues around that. And for when we think about motivation and theories of motivation and why people, their intent to stay or leave, it's all different. So as a leader, you have to really dig deep and look at your team, not just as one, but you have to look at them individually and why are they staying to work with you or for you, and what would be the reasons they would leave. So I'm always looking at that masterfully, because I cannot afford in nursing education to lose one person. The time, the energy, and the cost to replace people is just, like you said, it's just incredible. So why wouldn't I, as a leader, spend that extra time and effort? So, I look at the theories of empowerment and structural empowerment, not psychological, but Cantor's theory of empowerment. It was something I looked at a lot in my master's program and my doctoral program. And I looked at faculty, what they felt they needed to be empowered. And that was different across the board. So you have some faculty find resources. They want to walk into their classroom and they have good technology and they feel comfortable and they have all the training that they need, right? And then there's information. Some faculty want to be in the know and have information and they want transparency. Some faculty want opportunities. I want opportunity to develop myself, to go to a conference, to scholarship. And then some faculty just want to be supported. They want to know, I am a human. I have life at home. I have work-life balance, and I need my leader to just understand that. So when I think about empowering my team for resilience, it's really about understanding what is important to them and what motivates them to stay working for me.
Instead of just the exit interviews that most leaders conduct, let's conduct some stay interviews. Why are they staying? What is working well? Let's do more of that. Let's find out. And yes, do an analysis of why people have left and not just, well, let's just give them a great parking spot and throw some pizza parties. That's not going to cut it. And we've seen that. So I think that's really important to find out why they're staying and really build their capacity and nurture them along the way.
There will be a certain percentage of your faculty, your team that has to leave. People relocate, they move. That happens, life happens. But those that don't, I agree with you. We need to do much more better on checking in with our people and understanding them.
Absolutely. And with technology, you can instant message them, ping them. How you doing? Just checking in on you. And really it's that authentic leadership, like you talked about, right, which can be felt within about 15 seconds after you meet someone. You can feel that frequency and know that they care. So retention is one outcome, but connection is another, connecting to your faculty. So what types of guided sessions or facilitated discussions were most effective in helping participants connect their strengths to team success?
So one of my best success stories I can tell you was when I came upon the Strength Finder for myself. And it was in my PhD when I was doing my PhD in leadership, and we had to go through this process. And so the first process was, of course, learning about yourself. And I was in my cohort, and they put the cohort of, I think there was like 40 of us, and they put all of our strengths on a grid based on the 34 strengths. And when I saw the grid, they did a scatter plot, and I saw my top strength, which is activator. I saw it on the scatter plot, and there was no other dots around me. I was all by myself, and the person giving the presentation, I looked up and I raised my hand and I said, "Why am I alone? Nobody around me and that executing in this room." And he looked at me and he said, "Oh, you're an activator? You're very rare." And I was like, "I am?" And he's like, "You're rare." And he's like, "You are one of the most important people on the team." He said, "Without you, nothing gets done." He said, "And we can't have too many of you." Because, so, but I sat there and I said, okay. And I'm thinking this, and I thought to myself, is this good or bad? And he said, "Let me guess. Your whole life, you have been criticized for this." And it hit me that I have, because people will say things, even people that care about me. "Oh, you're like, a wheel and a hamster. You just keep going. You're just like a dog with a bone." And I don't think people are trying to be, "You need to slow down," and it's all really important feedback for an activator, because, there's strengths and then there's the shadow that goes along with that. But that was the first moment I realized, okay, I need to understand myself. And when I brought that back to my team, and my whole team then did the Strength Finder, and we scatter plotted everybody. Okay, the whole organization did it, actually, because I brought that back to the organization. I said, we got to do this. But for our team in nursing and health science, when we put our scatter plot down together, it opened up conversations and allowed us to love and care for each other in a different way. So it was incredible because it was almost as if, you go from having conflict around conversations in meetings to then knowing that you have several people on your team that harmony is their number one strength. And when there's conflict in a meeting, it messes with them. It messes with their harmony and they shut down. And so because we're a caring profession in nursing, you don't want your colleague to feel that way. So you reframe your questions. You have different conversations. I remember one time I was looking at activating something in a meeting. I was talking to my directors and I was like, this would be great. Let's do this. This is what we're going to do. And one of my leaders said, I know you want to activate, but I'm deliberative and I need a process. And I want you to be successful, so you need me. And it was like, critical conversations for us all to know our strengths so well.
Those discussions likely revealed interesting patterns, and I'd be interested to hear if you noticed differences in how newer faculty versus more experienced faculty engaged with the strengths-based process.
Yeah. So I remember reading an article and I can't remember where it was from, but when I was looking at research around incivility and new faculty and, why faculty succeed or don't succeed in the academic workplace, because we don't realize how we unintentionally eat our young. We talk about that for new grads, but it's just dynamics in meetings alone. You have the newer novice faculty and the experienced faculty, and you will see this in leadership that they will not talk. They're intimidated. They're afraid to give an opinion. They're definitely not comfortable. And that leads to, what we would say would be a psychological safety in our workplace. So we as leaders have to find a way to level that. And so this use of the Strength Finder. So one of the activities that I did was I had them team up in pairs, just pairs. And every meeting we used the Strength Finder in some way because I had it all printed, everybody's strengths on a grid, your name and all your strengths and all the categories that your strengths were in. When you're pairing, randomly people together that probably never sit together in meetings, you say, okay, this one and this one. And you talk about just simple questions. I work best in my strength when. That was the question for the meeting. And it doesn't take a lot of time, but it allows space for you to talk to one another and say, oh, and then another time I had all the executors go together and all the, relationship people go together. And then you visually see who your players are in the team, because again, we need executors, we need analytical people, we need the relationship healer builders. We need everybody to work together using their strengths because I can't have all my top strengths there. I don't have them all. So I'm a visual person. So, just moving people around in your team to show that. And it's like, oh, and then people get excited when they say, oh, your number one strength is my number one strength. Oh, that's why we get along. And it's all these major epiphanies that happen. I was having a conversation with the registrar, and anybody in academia knows this can be a wonderful relationship, or this can be a very challenging relationship working with records and registrar. And I'm an activator, and I like to get things done, and that means I want to make change, and that's very difficult for when you're changing catalog and processes. And after this whole experience in the organization with the Strength Finder, the registrar came up to me, or the records person, and she said, I didn't like you. She says, I did not like you, and I was struggling with you, and we're in a Christian organization. She's like, and I'm praying about it. I'm just struggling. And she said, and thanks to this, she goes, I understand you. I understand what you're trying to do, and it's going to help me. And we prayed and we cried about it. And it was just an incredible moment that we can, because oftentimes our strengths are also what people would say are weaknesses. And so really understanding that across the university can just be you can move so many barriers aside.
Well, faculty engagement definitely is the key, but what about our students? How do you see strength-based leadership impacting student learning outcomes in the long term?
I think in nursing education for the longest time, because I've been in nursing education for over 25 years, is we hire people because we need to fill a hole. I need to fill a Med-Surg 1 position, or I need to fill an OB position. We're talking about specialty versus strength, right? Or I need a clinical position. And people, they choose to take that job and they come on. And what I find is if people are misaligned with whatever they're doing and their strengths, then it does affect the students, right? Because the students are your customers. So if you have somebody that hasn't been in the clinical setting, hasn't worked, they've been a nurse leader, and they decide to come to academia, and they're now teaching a theory clinical course, and they haven't had, like we said, the mentorship, the training, it's maybe not their specialty. That student in that course is going to experience that, right? And it's probably not going to be positive. So I think as a leader, strategically, we have to get past of everybody has to do clinical and everybody has to do certain things. And we have to say, what can this person do and add to the team? Maybe the nurse leader needs to be teaching the leadership course.
Yeah.
And maybe we need just to move around a little bit. Maybe people don't all have to go to clinical. Maybe they should do lab and sim, and that may play to their strengths and their abilities. So it's about assessing and looking at your team, and when you get your team dynamics in a place that you can, then it'll affect the students. And that can be hard as a leader. You may walk in, especially if you have somebody that has become the leader, like when you choose the leader amongst faculty, like when a chair gets chosen versus somebody coming from the outside and being hired in, a new person. When you then start to lead people that were once your colleagues, you now have to start making different decisions, and people may not always like the decisions that you make. So always reframing how is this going to affect the students is, I think, a really important piece, because we are in the business of making, nurses, graduate nurses, we are in the business of educating people, and we want their experience, not just to have a positive experience, but have good outcomes. And that's measured by all of our accreditation standards.
Kind of looking ahead, many leaders face practical hurdles. So I can think of a couple. What advice would you offer to nurse leaders facing kind of resource or buy-in challenges?
When we think about buy-in in terms of the strategic plan, if you've ever read the book, The 5 Dysfunctions of a Team, I would highly recommend it if you haven't. It's not a nursing book, but it looks at team dynamics. And the very first thing on that pyramid, at the base of your pyramid, is trust. And you have to build trust in your team in order to get buy-in. And so I try to be, as I said, authentic. My values, they don't change. And whether you agree or disagree with what we're doing, my value-based system, and we build that trust. And we're not always going to agree. Oftentimes, I always say leadership is alone, because you have to follow a strategic plan. You're looking at, you're having different conversations with finance, and you're having different conversations with marketing, and you have to make a decision or make decisions that better the whole group and not just one individual program or one individual person. And that can be really, really hard for people to buy in. So the best thing that we can do is to be as transparent as we can. And so I'd never want my faculty to think that I'm having conversations about them or their program or changes without their input. And at the same time, the democratic process is, we would say, probably the best, right? To get everybody's input. But at the same time, sometimes you have to be, authoritative and autocratic, and you have to make a decision. It's a real balance with trying to get buy-in. And all I can say is you have to continually show that you're trustworthy with your team, whether they like your decision-making or not, but that they can trust that you have their best interest.
I think about the new nurse leaders that are taking on roles such as a program chair, department chair, associate dean, or dean. Do you have any advice for them? Because whether they've had training to lead, right? They've had some leadership courses, or perhaps not, and they're in this role just starting out and maybe feeling a little bit of an imposter syndrome. And how can I'll say, strengths-based leadership really help them to lean into their strengths as they start this new role?
This is a great opportunity. When people finally go in and take that leadership role, a lot of times they have the strengths of a leader. They've been identified. It's just the timing, right? So when you have somebody that's finally been in that role, then you have to say, I remember my first time I said, I'm going to leave a tenured position. I'm going to go in, I'm going to do leadership. I'm going to be a dean and I'm ready. I had no idea what I didn't know. You can have all the best theories and you can have all the best intentions, but I think the first thing to do is, Kusner and Paz says, lead from the heart. You can never go wrong with that. So when you lead with good intentions and you are authentically good, your people will see that, number one. Then you can work on, yes, I've got to be more organized. I've got to do all these things. I've got to meet all these outcomes. But you are nothing as a leader without your team. So, you can't get all the work done in the whole nursing program by yourself. You're just there to help support and cast a vision. So when I think about new leaders, one of the things I say to them, have you ever played a cooperative game? Have you ever played a game where everybody is trying to win? That's what we're trying to do. I'm not here to evaluate you so that it's not like in a nursing job where you get an evaluation and you're trying to, are you competent or did you do these things? No. If you win, if you are successful and you are supported and you make goals for the year and you can accomplish those, then the students win. And if the students win, the outcomes are good, right? They have good board pass rates. They have good graduation satisfaction with their program. And then guess what? I win as a leader. So we're playing this cooperative game and we all want to win. And I just think that's one of the most important perspectives to remember as we are trying to lead as new leaders. So if you are a new leader, I would suggest highly think about your team first, lead from the heart, but then lead yourself and learn about yourself. The best gift you can do for yourself is to understand yourself as a leader. And oftentimes we don't make time and space for that because we're so busy, doing the daily tasks. So make space for that. I wish I'd done that earlier.
Yeah, to be the North Star, create that shared vision, being a fierce advocate for your team. And like you said, if you're leading from the heart, they know you're authentic. So what is one spark or pearl of wisdom or key takeaway you'd like to leave with our audience today?
As I said previously, don't wait to learn about yourself. It took me many, many years to realize that was one of the first things I should have done as a leader. And I say learning about yourself today and paying tribute to yourself through your whole life. The things that were hard in your life, everybody has a journey. And the things that are hard and really hard to face growing up, you may have had different things in your world, but those are the things that made you who you are today. So acknowledge that, because we cannot begin to care for our team and our students and the nursing program without really caring for ourselves first. And as nurses, we often put everybody first. But my spark would be put yourself first, because you need to as a leader.
Thank you so much, Kimberly, for sharing your insights and experiences with us today. I think your perspective on strength-based leadership and team building really has illuminated new pathways for excellence in nursing education. And to our listeners, we hope this episode has sparked ideas and inspiration for your own leadership journey. Thanks again, Kimberly.
Thank you.
Thanks for listening to Lippincott Spark. Be sure to subscribe, share with a colleague, and leave us a 5-star review. You'll find links below to learn more about Lippincott nursing products and services. Until next time, keep learning, keep leading, and keep sparking innovation in nursing education.